Today we're going to be demonstrating tensing a patient, how to set somebody up, how to properly prepare them, how to clinically do it. So we have Tiffany here, and Tiffany's cleansed my skin with alcohol, placed the electrodes properly. Tiffany, do you want to talk a sec about properly placing the electrodes?
Sure. What Nate said, I cleansed the skin with some alcohol. First on the face to place the small electrode, and making sure that there's no makeup or skin oils or anything on the skin, as well as we want to make sure that the patient has shaved. There's no facial hair underneath the electrode. And then we're placing the small electrode on the face right over the coronoid notch, so that the top edge of it is right in line with the tragus of the ear.
The other thing we've done is we've actually placed a large electrode. I don't know if you can see it. Right behind the collarbone, basically at the neck area. There's a little triangle indentation. I don't know if you guys can see that okay. But if you just take your collarbone, right behind your collarbone, there's a little indentation. That's a proper placement. The other thing that we're finding doctors are doing is they're placing the large electrodes actually physically square on the trapezius muscle. But the point of tensing is more so to innervate the nerve to contract the muscle rather than physically placing it on the muscle. That's why we've placed the TENS electrodes over the coronoid notch that innervates the 5th and 7th cranial nerve, and then in this area down here that innervates the 11th cranial nerve, which controls all the head and neck posturing muscles. So the first thing that Tiffany is going to be doing is she's going to be taking channel 1 right here, and she's going to be attaching that channel to the upper electrodes, the small electrodes that we've placed over the coronoid notch. Secondly, what she's going to be doing is she's going to be taking channel 2 and connecting those to the lower electrodes, larger electrodes. Why don't you go ahead, Tiff?
So on the lead wires, you'll see that one is red and one is black. And the red one goes on the right side of the patient, clips right onto that small electrode on the face, and the left black on the left side of the face, of course. And same with channel 2. Right red, and left black.
Okay, now we're ready to begin tensing. Prior to beginning tensing, we would like to make sure that the patient doesn't have any contraindications, such as a pacemaker, such as pregnancy. Although it can be utilized on patients with pacemakers with the permission of a cardiologist. Before we begin tensing, we want to make sure that there's no lights flashing on the bottom, and we want to make sure that the amplitude knobs are set to 0, the balance controls are set to balanced. To begin tensing, we're going to press the on-off button. Now, that activates the flashing standby button, and to really begin, we're going to press the standby button. That's just kind of a safety feature we built in. Now you can see that the green light should be flashing. Can you guys see that? There you go. You can kind of see that. At this point, we are going to slowly turn up the amplitude, generally to about 2. At this point, we're going to ask the patient how they perceive the tensing. Is it okay? Does it hurt them? It's not going to at this point. We're just trying to make the patient as comfortable as possible. But this is a good point to see and ask them, does it feel balanced? And physically we can put our fingers on and see if it feels balanced. We're going to do the same thing for channel 2. Okay. And from there, what we want to do is we're going to set what's called threshold. On the path to properly setting up the TENS unit, we are going to notice the patient's facial muscles start to twitch, most notably the eyes. So you'll see my eyes twitching. I don't have a nervous tick or anything like that. It's just a result of the TENS unit. It's important to let the patients know that this is going to be happening ahead of time. So let's slowly begin to turn up the TENS unit. You'll see my eyes start to twitch momentarily. We obviously want to make sure that the patient's comfortable, but we also want to set the TENS unit to a point where their mandible is starting to lift. The best way to note that the patient's mandible is lifting is to take our pinky finger and put it in between the teeth. You'll immediately feel the mandible rise into your pinky finger. Mm-hmm. Generally, it's recommended that the patient is going to be TENS between 30 and 45 minutes. But again, this is going to depend on your personal philosophy and the patient's musculature. If the patient's really tight, you may want to go a little more than 45 minutes. If the patient isn't very tight, you may be able to get by going less than 30 minutes. Again, this is also a good point to check for balance. We want to, and we can also take our fingers and we can feel. Again, it's good for the patient to feel that the balance is equal on both sides, and it's good to clinically feel.
So when I palpate Nate, the electrodes, I feel that he's getting a little bit more of a pulse on the right side than he is on the left side. So therefore, we'd want to balance that out on the TENS unit and put a little bit more pulse to the left side.
So what we're going to do is we're going to turn the knob to the left. Oh, okay. I kind of exaggerated it a little bit in this video, but just for demonstration's sake, you can see my jaw jumping. Generally, we're going to recommend that we have the patient keep their teeth apart at all times, so that there's no negative proprioception that's inputted throughout this. This device can also be used for high frequency tensing. What we were doing before was ultra low frequency tensing. High frequency tensing is used more in the physical therapy modality realm, and the purpose of that is to block the proprioception of pain. Another good utilization of high frequency tensing is for trigger points. So if we find a trigger point, just place the electrode right on the trigger point and we can deliver the high frequency pulse to alleviate the trigger point. In order to activate the high frequency, we are going to be pressing down on this first mode right here. Okay. So now we see not only the green light flashing, we see the red light flashing.